Live from the SABC's Auckland Park studios, good evening and welcome to the Watchdog. My name is Vuyo Mvogo, and here's what we have in store for you. Another quarter, another record in the country's unemployment numbers. Will we ever stop the runaway train? Well, former statistician General Padi Lehosha weighs in. Saving livelihoods? South African Tourism explains why the industry has successfully pleaded with the government to allow tourists to visit the country, even from those countries that have imposed travel bans. The province of KwaZulu-Natal is taking a similar stance, and so do the organizers of the popular Matric Rage festivals. We'll bring you all those stories and more. We begin here. Tomorrow, South Africa and the rest of the world will commemorate International World AIDS Day. As we've been doing over the past couple of weeks, we continue to bring you voices of dedicated South Africans who spend their lives helping and supporting people living with HIV. Mandisa Dlamini is one such person. She was 13 when she lost her mother in 1998. Gugu Dlamini, I'm sure many of you will remember that name and her horrific story. She was beaten, stoned and stabbed to death near KwaMashu Township outside Durban after admitting on radio on World AIDS Day that she was HIV positive. Mandisa, her daughter, now runs a foundation in honor of her mother, providing support to people living with HIV and AIDS. She joins us now. Good evening, Mandisa. Thank you so much for your time. Many of us can't even begin to fathom how what International World AIDS Day brings to you, what, the images or the memories it conjures up whenever it is being commemorated.
Good evening, Vuyo, and good evening to your listeners at home. Thank you for inviting me to your show. Wow, World AIDS Day. It's one of those moments where one goes through mixed emotions. When you're not sure if you should be happy or sad. Looking back in 1998, when a 13-year-old young girl witnessed such a painful moment where her mom was stoned to death because of her status. And every year after that, when it's the 1st of December, you are always reminded of the incident. And you always look back, and see what you've been through as a young girl, the stigma that came with the incident. And then 23 years later, you look back and you say, had it not happened, was Gugu Dlamini Foundation ever going to exist? So that's why I'm saying it's mixed emotions. I have those, good moments, but at times it's very painful, I have to say.
How has it impacted your life? I mean, we're going to talk in a while about the work that you do, but would you say it changed perhaps the course you had? I can't remember how being 13, sort of how, what one thinks of anymore. But I'm just thinking, when you go back, to 1998 and looking back at the things you've had to do over the years, including, of course, the great work you're doing in honor of your mother, do you think that your life changed completely from what it could have been, given the choices you've subsequently had to make, primarily, of course, or by and large, in honor of your mother?
Yes, it did. I think when I look back to 98, that 13-year-old young girl, who used to say, when I grow up, I want to be a social worker. And I remember how smart I was in school before the incident took place. And I remember how after the incident, I just went low because I've lost a pillar. I've lost someone that I used to look up to, someone who was my life, because I never knew my dad. So my mom was a single parent. So she was the only face that I knew. My hopes and dreams were with her. Mm-hmm. Now having to dream again and create another, a future without her, it was very painful. Mm-hmm. But going back and starting the foundation and doing the work that I'm doing now, for me, it's like she knew she was going to pass when I'm 13. And she had to say, she had to pass the bat and say, run with what I've started.
Mm. Of course, because before her death, she had been a volunteer field worker for the National Association of People Living with HIV and AIDS.
Mm-hmm. 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 Yes, that's true.
Let's talk then about the work that you do or the foundation does.
Mm-hmm. Okay, Gugu Dlamini Foundation, we started in 2010. After my mom's death, I was adopted in Pretoria. And when I finished my studies, I remember my mom who adopted me. I asked her, Mama, what can I do to say thank you for everything that you've done for me? And she said, my daughter, if you can just go back to the same community that killed your mom and do exactly what I did to you. I've given you another chance. Identify other young women like you and try to impact their life for better. So that's how I came back and started the foundation, working with young women and girls with issues of gender-based violence, HIV prevention, making sure that there is no child in that area who goes to bed on an empty stomach. Healing, because I had to heal and face the killers, and work with them also, the killers, to say how can we work together and, erase what happened and start afresh, because I now understand what you did it out of fear of the unknown. So coming back to KZN after I've, went to Pretoria, I had to start there by forgiving the killers and starting the Gugu Dlamini Foundation, identifying other Mandisas like me. I'm talking young people who were raped, young people infected and affected by HIV, young people who have lost hope, young people who are a Mandisa, or others who are a young Gugu Dlamini. And I had to say, it ends here. I'm here to break the cycle of stigma and discrimination of people living with HIV and stigma and discrimination of women and children, and to make sure that gender-based violence stops, So basically that's what we do at the foundation.
Incidentally, the case of your, how your mother died, there was that intersection. One, we're dealing with a pandemic at a time that was beyond the comprehension of so many people. And right now, as we speak, we're facing another pandemic, gender-based violence. We've seen the stories coming out of the court's testimonies by people who have come forward of just how that all the atrocious things that people have been doing, committing to women by and large.
Oh, wow. I always say gender-based violence is like HIV. stigma and discrimination, it changes its color. You know, when you think you understand, right when you are at the point of saying, I now understand how to deal with this matter, it changes and becomes something else. And right when you think, I'm perfect where I am, my life is perfect where I am, it strikes. Whether through you or your family or whoever, that you know in your life. And looking at this new gender-based violence and how young people are being killed. Recently, I was in an event with Uyinene and River Steenkamp's mom, and for the first time, I actually sat on that table and I was looking at them, and I actually felt sorry for them. I literally cried because I felt what happened to my mom cannot be compared to what they are currently going through or what they went through. It broke my heart. And I even said to them, I'm sorry for what happened. I'm sorry it had to be your kids. But I believe there was a reason and a purpose for it to happen. Because if I could go back to that 13-year-old Mandisa who used to say, when I grow up, I want to be a social worker, and look at her now, I wish I could go back and tell her it's going to be okay. One day it will come to an end. You will make it. The sun will shine on the other side. So it's a lot. I don't know where to begin. It's a lot.
What do you rely on, or who do you rely on for you to be able to continue with the work that you've been doing?
My mom, Kosi Mashiko, my family in Pretoria, my husband, my kids, my colleagues, Abuneli, Nomonde, I can count all of them, my friends, my family, and the kids that I serve every day. They give me the reason to wake up every morning and go to Kukudlamini Foundation, because I see myself in them. When I see them growing up in that community, I see the 13-year-old Mandisa, and I know what it's like. And it pushes me to wake up even when it's hard, even when it's painful, even when I'm reminded of the incident, even when I see the killers. But what gives me hope is to hear them saying, we need help from Kukudlamini. Listening to someone who actually killed your mom coming to you and say, I need help. You have mixed emotions. You don't know whether to get angry, reject him, but then you realize I've been given a chance, to start afresh and prove that I have healed. So that's what motivates me every morning, every day. That's what supports me to go back to Kukudlamini every day.
And material resources for like providing, food and basic needs to, teenagers especially.
At the moment, we don't have funding from the government. Most of our funding comes from private sector and other big NGOs like CCI, Masipepe, HST, Rivers Foundation. So it's different organizations, but not in the government space. Those are the people that, make sure foot forward. They make sure that the foundation is sustained. Our board members, their role in making sure that they go out to build it, and all these other, shops, and talk about the work that Kukudlamini Foundation is doing. And you have other private people, private companies, individuals who believe in the work that we do, and who are always there to make sure, we sustain the work, we cook for the kids. we provide educational sessions and informations and whatever material that is needed in our community.
Mandisa, that's why we're going to leave it for this evening. Thank you very much for your time.
Thank you. Thank you so much for you.
Mandisa Dlamini is, of course, the daughter of Gugu Dlamini, who died a brutal, very brutal death on a day she disclosed that she had been living with HIV. And tomorrow, being International Wales AIDS Day, as we've been doing over the past couple of weeks, we're bringing you, those voices of South Africans who have really dedicated their lives helping, supporting people living with HIV. And to think that Mandisa was 13 when she lost her mother in 1998, but of course she has since then really been a pillar of strength to so many people who went through what her mother went through, but also been helping those, incidentally, who actually were part of or participated in killing her mother. She's been doing some really good work over the years, which she just spoke about. And I'm sure if you're out there listening, people like her do deserve our support for them to be able to continue doing the great work that they have been doing. We're going to take a quick break. After that break, South African tourism explains why the industry has gone to the government, pleading with it to allow tourists to continue visiting the country, even from those countries that have actually slapped us with a travel ban. That conversation coming up in a moment. Saving livelihoods, that's what the tourism industry is trying to do. Of course, a task not made easy by this new COVID-19 strain that everyone across the world is now talking about. Now, many of you would know that quite a number of countries have actually slapped us with a travel ban. We're not the only ones. Countries like Botswana are in the mix. And Tebe Kalafeng is a board member of the South African tourism. They are really doing their best to make sure that this industry does not die. He joins us now to take us through, Tebe, why you decided as the industry to plead with the government to say, allow tourists to visit our country, including those countries that have imposed travel bans on us.
Oyo, how are you? Good evening.
Thank you. I'm very well, thank you, sir.
You asked me the question, why should we do that?
Yes.
Well, I think it's quite important because if you look at it, between 2019 and 2020, the number of tourists to the country went down by about 75%. And that is quite a dramatic number. But let me tell you the true impact of it. The true impact of it is tourism used to contribute about 3 to 4% of the GDP of the country and used to employ about 4.5% or about 5% of total employment in the country. So it is quite an impact on the economy, which is tickling up. As you know, we've had 4 consecutive quarters, and the last one about around June, I said 1.2%. So that is the reason why we need to get our tourism back, why we need to get people traveling into the country and around the country.
Mm-hmm. Of course, what sparked this the conversation we are having now is, lots of people started seeing some of the airlines posting that they will be coming, but they will only be dropping off people, and they will leave without taking passengers from South Africa some people, of course, acting very angrily to say, why are we allowing them to do that when they can't, when those countries can't reciprocate? And I started asking around, and one reason is that we have to make efforts to, our government has to make efforts to try and bring people home who had been outside when we slept with these bans. But I then got told that the tourism industry had also pleaded with the government for the reasons you have just spoken about, not to retaliate, but to make sure that as safely as it can be done, we should allow people to come in, to the country. Now, one of the questions I've been battling with throughout the afternoon was, what happens if the numbers go up? Because the health minister a few days ago was asked the same question, where he was asked, are you going to restrict, province to province traveling, for example? Are you going to impose more bans? Now, one thinks, if we then bring the holiday makers who do want to come to South Africa, irrespective of, the pandemic we're confronting, how will we manage this in the event we have, say, a lot more people coming into the country, in addition to, local people who will themselves be frustrated? Because I think everyone had geared themselves, towards a, more festive period, yeah.
Well, just last week, just last week in Durban, we had thousands of people from all over the world at the IATF. And IATF, as you know, the Intra-Africa Trade Fair, which is about boosting intra-Africa trade. This year, the focus was on boosting intra-Africa trade across the continent. And we had zero incidents. Zero incidents because we had the protocols in place, and people were being tested properly, and people were being let in only when they qualify. So I think as a country, in many ways, we've had 18 months now to gear ourselves to be able to understand how to manage this crisis. And if you look at where we are from a vaccination, we're at about 41% of the adult population has been vaccinated, and about 35% or 36% are fully vaccinated. Our job really as South Africans, is to encourage more people to be vaccinated, most people to observe the protocol, and we've proven that we can handle this. Because what we've also realized is that when people are vaccinated, they can at least the impact of the virus is not as severe. So there's less fewer hospitalization as a result thereof, and also the impact on the people's health is much less harsher than it would have been if they were not vaccinated. So I think if the numbers increase, if we are vaccinated, and the president has said it many times, and everybody's in the industry, let us vaccinate, keep our distances, wash our hands. When we're doing all that, we're mitigating against the severe impact of this. I think as a country, we're well geared towards managing the virus this time around than we would have been perhaps last year.
Well, a lot of South Africans have been critical of the way our government managed this process, saying, well, it played into the hands of, very prejudicial, racist even, people who imposed on us bans they wouldn't impose on other people, because they're seeing these, dirty, infected Africans coming, to their shores, even though they themselves have much higher numbers, of infections in their respective countries and continents. Just your thoughts about how this process was managed, from the time that this variant was discovered.
Well, I mean, to start with, we must acknowledge something that the world knows and we know, that we have some of the best scientists and medical minds in the world. And some of our scientists are well respected globally. So we know that. The one thing that Joe Biden, the President of the United States, said last night, which is important note to acknowledge, is that as part of the oath of the medical community and also as part of a global community of nations that are all have got the good intentions of combating or fighting this virus. It's important for us to be transparent. It's important for us to be collaborative. It's important for us to communicate, and that's what our medical community has done in this instance. Yes, the way that we've been treated by the rest of the world for being transparent and for contributing towards alleviation of this is definitely prejudicial, and certainly if this had happened in any other country, outside of the continent, would not have been treated as such. So your question about how the government has handled it, well, I think as always, we as a country and as people and as an industry, we can always do better. But I don't think I can't see how much better we could have done in our efforts to contribute to a global alleviation of this virus by not being transparent and by not being communicative. I think our Minister of Health was quite communicative about this. Our Minister of Tourism has been quite communicative about this. So the entire industry, as well as the scientists of well, have all been trying to do the right thing because it is in our collective interest, not just as South Africans, but as the global community to ensure that we alleviate the impact of this virus. What we do know for certain is perhaps this virus or any virus is going to be a part of us for a long time. And that's why we are promoting the need for everybody to vaccinate, for people to keep their distance, to wash their hands. So, I mean, I don't think we could have done any better than this, but of course, there's always lessons. And as a country, we probably can learn one or two things, because what we've learned, what some of us are learning offline, is perhaps many other countries, some countries perhaps would have been aware of this emergence, but they would have kept it quiet because they perhaps didn't want the negative impact of this. I think the mistake that perhaps we did as a country is to be as transparent as we were, to be as communicative and as we were collaborative. But if that's a mistake that we need to be punished for, then I guess at the end of the day, as a country, we ought to be proud of our contribution to all this. As you know, it is not a South African virus. It is a virus discovered by South Africans. And that is perhaps the nuancing in the message that perhaps didn't go down well. But irrespective, we would have been repositioned because we are Africa and everybody sees us as a dumping ground of negative of negative messaging and such.
You know, I mean, on the back of what you just said, I remember watching Joe Biden giving a media briefing yesterday. It was around 7 o'clock, and then he said a lot of things that really didn't quite give any clearer indication as to why exactly they did that, especially after, and the minister confirmed this yesterday here on the show, after the South Africans sat down with them and explained to them what had actually happened and tried to, knock some reason into their minds. But I then noticed that subsequent to that media briefing, where he was confronted, Joe Biden that is, by several journalists as to why he decided to slap, African countries with a ban. He then went on to post something different from what he had actually said during that briefing. And I want to bring up this tweet, and I'm going to read it. The day the World Health Organization identified the Omicron variant, I took immediate steps to restrict travel from the countries in Southern Africa. But while we know that travel restrictions can slow the spread, they cannot prevent it. We will have to face this new threat. It would seem that, some reasoning, and of course selfish interest, because if you look up further on, he says, we did this to give us time to get people to get protection, to be vaccinated and get the booster. That's the reason for it. So it's them correcting wrongs that perhaps they should have corrected a long time ago, but finding a scapegoat, of course, for doing it now and not doing it earlier.
Well, I mean, the one thing he said last night, and the Americans have kept saying, is he said not to punish the countries, but to protect Americans. So you asked me earlier if there's something wrong we did as a country.
No.
I actually don't think so. I think the lesson for us as a country is we need to focus on protecting our country as well. We need to focus on protecting our continent broadly and our country specifically. Because what we've learned, even when it comes to the issue about vaccines and many other such remedial initiatives, that Africa will always be put at the back end of the queue. So as a continent, as a country, we need to focus on what we need to do to protect our country and our continent, and what we need to do to advance ourselves such that we are not so dependent on the rest of the world. I think luckily for us as a continent, and certainly as a country, is that about 75% of the tourists to South Africa come from the rest of the continent. What that says to me is that it's an opportunity for us as a continent to grow our intra-Africa, to grow and perhaps rely more on our intra-Africa travel. But also, if you look at from a domestic, I mean, just between 2019 and 2018, I think or so, our domestic expenditure grew by 70%. So there's a greater opportunity to get South Africans to travel the country, to see their country at better prices perhaps than they would have during the boom times of international travel, but also to grow our SADC and our broader African intra-Africa business. So in other words, we need to be as selfish as the rest of the Western world is and focus on driving our opportunities here and encouraging our people to travel and to see more of their country and their continent.
Okay, and that's where we're going to leave this evening. Tebe Galafeng, thank you very much for your time. He is a member of the board of South African tourism. The South African tourism industry wants tourists from other countries to be allowed to come into the country and enjoy our offering. Of course, airlines are busy trying to bring back people who are stuck elsewhere in the world, South Africans that is, but of course the tourism industry has been saying to them, look, holiday makers that want to come to South Africa, please do allow them to come and don't retaliate. Don't do what your United States of Americas, your United Kingdoms are doing. Find better ways of striking that important balance between saving lives and saving livelihoods. Now, the province of KwaZulu-Natal is also taking a similar stance, and so do the organizers of a popular rage festival, who say they are going to do all the necessary, who also say they are going to do all the take all the necessary precautions to make sure that they avoid a further spread of the COVID-19 virus. Take a listen to what our reporter in KwaZulu-Natal put together for us on the back of comments that were made by KwaZulu-Natal Premier Sihle Zikalala, who says law enforcement agencies will be deployed in large numbers to ensure that visitors are kept safe. He was speaking, of course, today at the launch of the Integrated Safer Festive Season Plan for that province.
The men and women in blue ready to serve and protect. KwaZulu-Natal is the holiday destination of choice for many during the festive season. It's for this reason that the provincial authorities have put together various law enforcement agencies to ensure the safety of those who will be spending their holidays in the province. In Durban alone, over 400,000 visitors are expected to flock to the city.
It is critical that during this period, we leave nothing to chance, ensuring that our residents are safe on the road, and we limit the number of crashes associated with this time of the year.
A concern, however, is the possible spread of COVID-19 in places of entertainment. Authorities say they will ensure that strict protocols are observed.
Non-pharmaceutical measures are the best. Let's continue wearing masks, sanitizing, social distancing. Let us vaccinate. Let us ensure that we protect all our loved ones.
Zigalala says police will maintain high visibility across the province and on the roads to ensure motorists are compliant. Simpiwe Makanya, SABC News, Durban.
Other industries hardest hit by lockdown restrictions also continue to try and save both lives and livelihoods. Organizers of the Matric Rage Festival, set to be held in Balito, KZN, say all COVID-19 protocols are in place for the event. Earlier, Rage Festival organizer Darren Sandras spoke to on our sister program, The Full View.
The decision was made to move forward. Reason being is that Rage and the protocols that we've put in place and the safety measures we've put in place, as you can see from some of the images, are unprecedented of an event like this. I'm sure some of your viewers, or if not all of your viewers, go to restaurants and to bars and to social spaces where you interact with other people who sometimes sit down and don't wear a mask when they're eating or drinking, but you have no idea if that person's vaccinated. You have no idea if that person has tested positive for COVID-19. Rage Festival and Balito Rage and our sister festival Plet Rage are unique in that everyone who comes through the door has been tested for COVID-19 and has to have a negative test. They have to do so before arrival. And they also need to be vaccinated. They're also tested twice more.
Well, maybe you should tell us if you're going to any of these festivals, or you'll be visiting, or you'd hoped or planning to visit another province this festive season. I'm sure it'll be important for us to hear your views on those. Time to take another quick break. When we return, we're talking about the country's unemployment rate figures, which continue to rise. Welcome back. This is the Watchdog. The official unemployment rate in South Africa has risen to a new record high of 34.9%. The shock findings were released by Statistics South Africa today. It marks the third consecutive quarter of massive job losses in the economy since the beginning of the year.
No one expected an improvement from the record unemployment rate of 34.4%, which was recorded in the 3 months to June this year. And so it was. SABC says there were job losses across the formal sector of the economy between July and September. From manufacturing, mining to construction, the economy continued to shed jobs at an alarming pace. Overall, 660,000 people now have joined the ranks of the unemployed.
It is now abundantly clear that unless the working class, the poor, the majority of the black population can stand up and demand redress and demand that government change the direction it has followed for the past 27 years, we will continue to read about the horrors of unemployment and all that goes with it.
Kosaju believes that the impact of the COVID-19 pandemic is to blame.
This is the ticking time bomb, but equally we also need to accept as society, what can all of us do to address this unemployment crisis? And there are two fundamental things we can all do as consumers, as workers, as ordinary people. One is to vaccinate. part of this huge job losses is because you have a very low vaccination rate, and it forces government to keep us under restrictions. It makes it difficult for companies to return to full productivity, to ensure workers are paid, to avoid retrenchments, to enable workers to buy locally produced goods.
Economists have their own take on the worsening unemployment crisis in the country.
The rising levels of inequality and poverty, those tend to increase the pace of people going into discouraged job seek. The average cost of job seek in South Africa ranges between 300 and 500 rand. And so the deeper you go into poverty, the more likely you are to become discouraged.
The latest round of massive job losses has now pushed the expanded definition of unemployment, a measure which includes those who have stopped looking for a job because of losing hope of ever finding one, up from 44% to 46% of the country's population. Mbongeni Muchwa, SABC News, Johannesburg.
To discuss this further, we're now joined by Dr. Padil Hoshla, who is the former, or shall I say, the immediate past Statistician General of South Africa. Good evening, Dr. Hoshla. Thanks very much for your time. Another quarter, another record in the country's unemployment numbers.
Well, let me read you something here that the President wrote in his newsletter last month. Through the President Employment Stimulus, we have brought young people into the labor force in far greater numbers in an unprecedented manner in a short space of time. Some 84% of the participants in phase one were young people under the age of 35, and 2/3 were women. Now, if this were brought in unprecedented fashion, why is it that the employed who are youth dropped from 5 million to 4.7 million, and the youth that were as unemployed rose from 7.1 million to 7.4 million in the same period that the President is referring to? I think we need to strike a policy to take these issues very seriously. The President cannot read that kind of statement when, in matter of fact, that is not so. At the highest level, therefore, I don't think we care about unemployment. This is a serious problem. The President shouldn't be reading such a statement because he's presenting a false picture.
I know this is in the realm of...
This is a serious problem, and it therefore suggests that whatever is being said will be done. It's not being done because it will be said in words, not in action. So I think we really need to get a plan where we can hold people to account and reason. These levels of unemployment of the youth, who were 6.4 million of them were employed in 2008 in the age group 15 to 34. Today, it is 4.7 million. 2.1 million of them have lost their share in employment in a growing population. The number of who were unemployed then was 4.4 million. It's grown, it's doubled to 7.4 million. There is no hope in hell that this will change. Absolutely not.
So it's a runaway train.
It's a runaway train. And if the President has to read that kind of statement, surely, to the nation, it can't be right.
I mean, one would have thought that before the President can make such statements, he would be getting verifiable, authentic information instead of a PR from one department, you know, or the other. I mean, over the years, I mean, your Stats SA numbers have proven to be reliable. Nothing has gotten better, you know, than what Stats SA has been providing us with. Why not wait? You know, why allow, you know, PR, you know, that is obviously not based on facts, you know, to take precedence over reliable, scientifically arrived at numbers from Stats SA?
Chinese Professor Meme was invited by the head of the National School of Government. He makes two distinctions. One distinction he makes in terms of China, how it looks at matters, is that the matters are not about public opinion. They must be grounded in facts. And that is what then wins the minds and hearts of people. And those are the facts. And the Statistician General, my successor, has been providing these numbers. Why there is somebody in the presidency or from ever parties provides these kinds of numbers to the president beats me. But it shows that throughout the system, there's something dangerously wrong. And that has to be corrected.
You know, not too long ago, or the last time we had a conversation, you and I, here on the program, you spoke about the desire, something you said you found to be common, you know, across the state, which was the desire to find or see a good story, even when things are bad. That people would go out of their way, you know, to find that good story, when in fact the bad story is what we should be telling so that we can then do something about it.
Well, I mean, if you look at the Minister of Trade and Industry, he'll say we have created so many jobs, we have opened this number of industries. He doesn't say we have buried so many. Any situation that talks about death without death, then you know it is leading to tears. We need to know both those that were born and those that died. And that task is the task of the Statistician General, trying to hunger for good news and then publish those as though they are the real narrative. It's absolutely not right. It suggests that the development task and the developmental orientation is devoid of the realities that face this country. And the plans, therefore, are as equally shallow. And they are shallow because they are seeking a silver bullet, the master plans, that. And when you aggregate all those things that have been said, including the Reconstruction and Recovery Plan, the country must be very serious at interrogating that. It will only give you 3.3% growth. And at 3.3% growth, you are not going to grow jobs. We cannot say it's 3.3, that's all we can do. We should be asking the question, what should we do, not what can we do? We didn't elect people to say we can only do this much. We elected them so that they should do what is necessary. And what is necessary is to look at all possibilities, which includes opening up the macroeconomic framework and looking at all possibilities so that the master plans, as they are put in place, the industrial policy, the social policies as they are put in place, they are not suffocated by the macro and the debt to GDP ratio. Because those are the things that stifle the set of policies that should be in place. When we model all those things, they show that this country can grow at least above 6%. At the level at which we are, the macroeconomic framework is going to stifle growth, it's going to stifle all those plans, and will not grow at 3.3%. Will only create 2 million jobs from now to 2030 in a growing nation. So I don't understand for the life of me why we think a plan is something that runs from today to tomorrow, why a plan doesn't give you everything that you need to give and is transparent about its deliverables, and then you negotiate those deliverables.
Well, I mean, critics of the government's economic trajectory have been saying this over and over again. You're not the first and you won't be the last, and many more are going to continue to say that. But this seems to be all this criticism, constructive, it must be said, seems to be falling on deaf ears, and the country...
Well, they've broken sticks in their ears. That's a famous Ghanaian saying, that if you want to send them to the gallows, you first put broken pieces of wood in their ears so that they can hear nothing and see nothing. That's the problem, that we are not driven by science. We are not driven by long-term planning. I mean, President Beji was looking at the manifesto for local government, and he asked the question, this plan that you have by your own admission is not adequate. So why are you not looking at an adequate plan? And there are possibilities of looking at an adequate plan for as long as we tackle the macroeconomic the debt to GDP ratio threat, and all those things that the Treasury is pushing us into, the rejection of the basic income grant, and all those things, and coming up with a silver bullet of saying the master plans these things are not going to work. We've gone to school to understand some of these things. We have seen practices by other countries. South Africa's uniqueness is killing us. Speciality is killing us so badly. Even the United States is rejecting the IMF and the Standard Bank austerity measures.
Dr. Padley Hotla, thank you very much for your time this evening. He is the former statistician general. Well, not holding back at all. None of us, in fact, should. I mean, sitting with a new record now of 34.9% unemployment. Shock findings. Unless, of course, we move, unless we do things differently, we're not going to stop this runaway train before it kills all of us. And that's our program for this evening. Do join us again tomorrow evening, 8 p.m. sharp. Good night.